Welcome to session 8, Common Policies, Procedures, and HIPAA Compliance for Medi-Cal Providers. We are recording, so thank you for your consent to that. I want to encourage everyone to use the chat today for questions. We have a number of experts in the room that are on mute, but here to answer questions via chat. We also are going to be reviewing sample templates and tools together today, and I would love to hear from you if there are any policies or procedures, HIPAA compliance elements that you're working on right now that you would like direct technical assistance with, or you'd like a tool or a template. We can always add to those tools. For those of you that are joining us for the first time or watching online, I work for CSH. My name is Cheryl Winter, and CSH is a national nonprofit. We provide training and technical assistance. We work in the areas of policy, and we also lend. We're a community development financial institution lending for supportive housing developments. Our training team today includes myself, Ali Nimi, and Ambrosia Crump. Ambrosia will largely be managing chat, but Ali and Ambrosia, if you want to say hi, and then we'll hand it to Ali.
Yeah, I'll say hi real quick. So hi, my name is Ambrosia Crump. I also use she, her pronouns. I'm a senior program manager here at CSH. And you might have seen me already. It's been participating throughout your Medi-Cal Academy, but if not, I'm so glad to be supporting your journey and learning about the optional services available and how it looks like to incorporate this into your practice or explore that in the near future. So glad to meet you all. I'll pass it to Ali.
Hey everyone, Ali Nimi. I'm with North Star Policy Consulting, so I'm not an official CSHer. I'm contracted with CSH on this project and a couple others actually throughout the country to help with kind of the healthcare housing intersection and implementing Medicaid services. And let's see, I'm based in Minnesota. So thanks for having me today.
And you're supporting some agencies right now, Ali, in writing policies and procedures,
I am,
right?
yeah. I have 2 clients right now that I'm working with to actually write up policies and procedures. So I am knee deep in this stuff right now.
Great, thank you. All right, so today this is what we're going to cover. We'll first start with a brief introduction of policies and procedures. So what's the difference between a policy and a procedure? When is it necessary to have a procedure versus a policy that's standalone? Then we're going to jump right into those that are commonly required for Medi-Cal providers and for Medicaid providers across the country, those that we see commonly required federally or have common state guidance to incorporate those into your practice. Then we're going to dig into HIPAA. So these are the privacy and security standards that are a part of requirements for healthcare providers who are covered entities and the business associates of those covered entities. We'll dig into what it might mean for your agency in terms of practice, what you might need to add in terms of policy and process and review to be compliant, and then we'll be sharing templates and resources with you. So our learning objectives today are very similar. We want to provide you with a few checklists as well. So not only in thinking about what is common to provide and what do you need to be thinking about, but how do you get started on this? So we do have a policy and procedure checklist that your agency can go through, as well as a HIPAA checklist to get you started on what sorts of elements you need to review.
Great. So I'm going to kind of step back and talk about the basics of policies and procedures and what those look like and what they mean to your agency. So written standards and policies is just one part of an effective compliance program. So we kind of wanted to remind you, like this is important, but you also have to include it with other things like training, ensuring open lines of communication, responding to issues, those types of things. And this resource here is best practices tips from the Office of the Inspector General Compliance Program at HS. So you can take a look at that as well. So policies. Before we kind of dive right into it, we want to talk about what are the difference between policies and procedures, because they often go together, like, cereal and milk, but they're different things. And we use them for different reasons. And we need to include both of these in our written standards and guidance. Policies are really just a fancy word in some ways for rules. And if you like rules, this training is for you because there's a lot of talk about rules. I personally am one of those people that really like rules. Maybe I should have been a lawyer in a former life because I'm like the type of person that's like, is there a rule about that? Where is that in the law? How do I find that? That is really interesting to me. But I know there's other people that, that's not their thing and they're not as excited about rules as I am, but just kind of maybe think of it as like, taking your vitamins. Like it's good for the health of your organization to make sure that you understand and follow and know the policies to follow. So they're your strategies, your principles, your rules, and they could come at different levels of either coming from your funder. In the case of the Medi-Cal community supports, it could be at the state level. They could be coming from the federal level or from the managed care plan that you're contracted with. And you can also have rules that are specific or rules or policies, right, that are specific to your particular agency. So an example I could give is, let's say your managed care plan requires you to have an individual service plan for each person that you're working with, and that plan is required to be updated every year. So your the managed care policy, all it says is make sure your service plan is updated every year. And maybe your agency has a policy that you want to plan your service plans. You'll start your service planning process 1 month earlier than the annual updated requirement. That's your agency's role. So they can kind of you want to think about all the places the rule might come from the federal government, from the state government, from the managed care program, and then anything that makes sense to add in for your own agencies. Yeah, I just made up every year, but Jill said some plans require every 180 days and some say annually. And maybe your agency is like, we want to do it every 6 months, right? So the procedures is the policy is the rule and what you need to do. The procedures is really like, how are you going to get there and how are you ensuring that that rule is being followed? So it's a series of steps that you need to follow to make sure everything is consistent and being done the same way across your agency to get to that end result, which is following the policy. These are typically specific to your agency. So generally you're not getting them from those higher levels and like they speak to specific staff roles, how your actions and processes support those policies. These procedures need to be revised more regularly than the policies. They should be more flexible. So let's go back to our example of updating the individual service plans. So maybe your procedures are, and your agency, in order to make sure those plans get updated, you're going to have an admin staff or case aide pull a report every month to see who is coming up close to their renewal date or their review date. And then they're going to send it to the staff that is responsible for working with that person. And that staff will make an appointment specifically to review the plan with the person within a certain number of times. So it can get really specific, and depending on your agency and how it works, you might, if you're like in government or in a big bureaucracy, I feel like they tend to be a lot more specific about like how everything works. If you're in a smaller agency, sometimes there's more flexibility left up to the staff person. So it can get as specific as you need it to be, or more open-ended depending on kind of the situation, the culture of your workplace, and just your needs. All right. So here are some potential written policies and procedures that you're going to be wanting to make sure as you move forward with your Medicaid billing and Medicaid participation that you're going to want to have. So the first one is health records, something around what health records you're saving, and we'll talk a little bit about this more in the next slide, and how you're storing them. Documentation standards. So as Cheryl, I think, mentioned in the chat, you'll have to look at your managed care plan contract and see what their standards are specifically about what needs to be documented and how often. And that needs to be included in your policies. And then you might have your own agency's policies. Like maybe you want staff to make sure they're keeping up with their case noting and documentation weekly. Maybe you want them to do it every day. That might be up to you and your agency and how your agency works. And so, but having something written can be really helpful so that the expectations are clear for everybody and you make sure that you're staying on track. Cultural competence and humility expectations. Again, this is something that there's some, guidance, I think, from the managed care plans and from the state, but this will be more likely flexible and tailored to your agency's needs and culture. A non-discrimination policy. So that is part of a federal rule that does require you to have a non-discrimination policy and to post that somewhere in a place where clients can see it. And I think I don't know if you have an example of one of those, Cheryl, in the drive. Okay. So we have some examples of those. Client rights and about like what services they're entitled to, what kind of communication they're entitled to, things like that. Client consent, release of information, policies and procedures, and we'll get into some of that with the HIPAA discussion later in the training. Safety and risk management, and tracking, reporting, and investigating critical incidents. So I think those are pretty self-explanatory. The other thing I would add to this list is like program specific policies. So for your housing assistance program, like how do you deal with referrals? What is your capacity? Are you going to have a wait list? Are you, what is your intake process like? So all of that stuff, in addition to kind of these overall general policies, is really helpful to have written up as well. So some of the policies might not require specific procedures to go with them, and these would be called standalone policies, and they're purposely left to some more broad interpretation. And you can read the list of those, but the idea is that these are things that you kind of have an end goal, like promoting equity and inclusion, and there might be a variety of strategies that you're using to get to that, but you might have some specific policies that would be related to like your HR department that you want to have written and provided to everybody.
Great, thanks, Allie.
Yep.
All right, so I'm going to go through some of the policies that we recommend having procedures to accompany them because they really will be specific to your agency. And again, we have included some samples or templates. So either sample language that you can add to your policy and start building a procedure around, or some templates that include procedures that are typically used or that other providers have used. So these are going to be your policies that are around how you store client records, client protected health information, anything that's personally identifiable information about clients, and how you keep those safe and secure, how you ensure privacy, and then how you store records. Also, you'll want to have a procedure on how you respond to clients' requests for seeing their medical records. So clients can, under HIPAA, they have the right to view and request any of their records, which could be they want to see the assessment you've done on them, they want to see the service plan, they want to see any progress notes your case managers have written. And because you are being paid by a healthcare funder, including the federal government through the Centers for Medicare and Medicaid, then that entitles the client to have access to their records. They are considered health records that are legal medical records. So you'll want to have a process for, what do staff know to do if a client says they want to see it? How do you track that? Who pulls the records? How is it, shared? Is it printed? Is it mailed? Is it hand delivered? What are the acceptable methods that can ensure that the record is kept safe and secure? And so you'll want to have a process in place and training for staff so that everyone is aware that this is a client right that might be new. This is a process that might be new to your team, and this is how you're going to deliver on that. I'll say that it might be rare that clients request, but it's something that you want to ensure that clients understand is a right that they have, and provides incentive, as we talk about documentation standards, provides incentive for staff to really be mindful about staying objective as they note things in progress notes and identify strengths of a client and barriers to remaining housed, that goes into their legal record, and it's something the client has access to and has a right to view. And they also have a right to edit it. You may want to include information and a policy in how you handle health emergencies and communicable diseases. This is not necessarily required. So, because these are optional services and are not yet a part of the state's Medicaid plan, that is a Medi-Cal entitlement, then you may only be obligated to the HIPAA business associate standards, which do not require you to respond to health emergencies and communicable diseases in the same way. But you might want to look into, what are you currently doing to assess for health and safety, both of clients and staff, and how do you address those concerns when they arise? And you might want to write that down in a policy or a procedure. You will absolutely want to have policy and process around quality improvement activities and your internal review processes. This is something you'll want to include supervisors on, and you'll want to include frontline staff so that you can be sure that those internal reviews aren't overly burdensome, but are helping staff to improve how they document services and to improve how you're submitting invoices and getting paid for services. A new policy that might be required and a process that is required is related to staff receiving training on reporting waste, abuse, and fraud prevention. So this is something that there are templates and models and examples of this on the Department of Health and Human Services website for the Office of the Inspector General under compliance programs. And Ambrosia put that link in the chat. This is a requirement that is a simple training. Sometimes it's as simple as a piece of paper handed out and a discussion during supervision saying, because we receive Medicaid funding, we want to make sure that you understand what, fraud, waste, and abuse looks like for Medicaid reimbursement. And, if you suspect that, here are the ways you can notify your supervisor, staff, or go directly to the federal government. So that's a requirement for staff who are receiving Medicaid funding. You'll want to also include processes on corrective action and disciplinary processes. So if you have certain standards of documentation and certain standards of keeping health records private and secure, what then happens if you discover that it's not being done in that way? And what are the steps to correct that? the term disciplinary, I'm not fond of, but really thinking about what are the actions taken and the steps taken to correct those behaviors that put your agency or your clients at risk. We do have included staff supervision policies and processes in the template for you. This is something that, some of the elements related to compliance with new requirements or receiving referrals or checking authorization status, completing new forms or new elements within an individual service plan. Some of these things are going to be new, and so you may want to include them in your weekly or biweekly, monthly supervision with clients. And so that might be something you want to add into a process for your supervisors to know that this is something that should be reviewed regularly with staff who are providing services to clients. These are new requirements, and we want to make sure to support them in it. Also, staff training. There are several trainings that are going to be newly required if you are becoming a HIPAA covered entity. And that is really related to HIPAA privacy and security, but there also are trainings, there also are elements related to the delivery of training that are best practices for your quality improvement staff to oversee and for your HR teams to oversee. And so you want to make sure that you have a list of the trainings that you are offering regularly to staff and the trainings that are required of certain staff members. And when you are offering those trainings, is it at onboarding? Is it within the first 90 days? Is it annually? And then are you documenting how you are documenting where you are storing the tracking of who has attended what training? So again, that might be something that you need to add to your policies or procedures around supporting staff and staff learning. And so just being able to know who is holding that documentation of who's been trained and who's keeping track of it, so that if a managed care plan or a funder asks you about what you're doing for your staff training, you're able to quickly pull it up and ensure really for your own internal quality assurance and improvement, able to know that all staff are getting the training that you are committed to providing for them. Some contracts and funders may require staff immunizations. They may require TB tests and documentation of those immunizations. This is not something that I've seen in the community supports policy manual. It's not something that I've heard being in contracts right now, but I put it here because it is something that, some covered entities are required to have documentation of staff immunization. So that's something you may want to think about and look at what your funders are requiring. Okay, I want to share an example, a procedure example that we have, one of the documents we have. So let me pull this up. One moment. We're wanting to show just the health record documentation template. So this is a template here, and let me share my screen of it. That does include both the policy and then the process. And so I want to give you an example of, and I apologize for the technical, an example of what this looks like. All right, so here is this is a sample template, and these are the templates that are included in that folder that we shared with you. So you can go ahead and identify if it's a new policy or, an amended policy, what the revision date was. And you'll see the policy is very short. So it's that you want to ensure that clients' health record documentation is maintained in a manner that's, required by funders, that's current, detailed, organized, and meets established goals for record keeping. You may want to include and complies with XYZ funders or local, federal, and state, regulations. You could include something like that. But when we scroll down, so there's a definition section, and then you scroll down to the procedure and responsibilities section. This is going into detail about the types of, what constitutes a health record, what needs to be included in a health record, who may be reviewing your records and how they are reviewed. But I'm going to scroll down to the pieces around what is included in a file. So this is an example here where you're talking about a process, but right now this is a checklist. In your quality improvement plan or in your procedure related to quality improvement, you would likely want to link back or refer back to your documentation standards and then talk about what is the process for when you are going through and doing an internal review, you are checking for these elements. So it's common for your procedures to refer back to other policies and to then cite, there's a part of a procedure that is included, but this is for a different staff member to ensure the quality of. So here, this is that, this policy is going to be reviewed and applied by anyone that is providing services that are handling client files. This could be an electronic file, it could be a paper file, but it should include these elements, within it. So the assessment, the referral and authorization form, if there are any incidents that happened or client grievances filed, those also go in the form. Then when you are doing your quality assurance, you'll want to make sure that it's also saying that you are verifying that client files include the necessary documents and information as written in your documentation policy number XYZ. So this is an example just of how you might include a checklist. You may want to give more additional information of who's going to do what, and cite the role, the staff role, rather than the name of, rather than the name of the person you staff the role, cite the role in your process. And sometimes it's advisable to turn these procedures into a workflow. So if it's a really complicated procedure that has multiple bullet points, you may want to just turn it into something that's also visual, to help staff know who is doing what. Yes, there are several templates that we created, the actual, like that template where you can then just go in as a Word document and edit it. And then we also included sample language that is typically the policy and a simplified process where you can then edit it, but it's not in that template. So there is one larger Word document that says CS for community supports sample language. And then there are others that say that they're a template and it will say which policy or procedure it's a template for. And let me know if there are others that you'd like examples of. There are so many that we have that it's hard to know what to include and what not to include. Some are very specific to certain agencies, and I've found those around staff safety, and staff safety in homes, staff safety in vehicles, staff safety in offices, client safety. Some of those are really specific to the agency location and the types of services they provide and how they provide services. So I did not include those, but I'm happy to answer questions or share examples if you'd like to see those. It will be really important as you're thinking about client grievance processes, the client grievance form and process is likely required in your contracts with managed care plans. You'll want to understand when they want to hear about client grievances or what they expect you to be presenting to clients in terms of their rights to change providers, to file a grievance. Do they go directly to the managed care plan? Do they go with you? And I'd say to get ahead of that, you'll also want to be working on client satisfaction surveys and hearing from clients about their needs with regular check-ins, and including that as a part of the check-in when staff are writing progress notes, that they're always asking clients how they're feeling about the services. Is there anything else that they would like to work on? And just understanding their satisfaction with the services being provided. I want to highlight that there are lots of free trainings and free checklists, guidance from the federal government on things related to HIPAA. And then there are also a lot of not free trainings, guidance, and groups that are, offering you a little something, and then they want you to pay for something more. And so I want to first provide you with the links to the federal government guidance, and there is a section called HIPAA for Professionals, and this is an excellent resource. It offers links to trainings on YouTube that the federal government has created. They include slide decks that you can use, fact sheets that you can use, checklists, all sorts of things. And then we also have links to the False Claims Act and the anti-kickback statute, which are additional requirements that your compliance team will want to be aware of related to if you're receiving federal money, through Medicaid, that you'll want to be aware that you're not also then receiving certain favors from providers who are saying, hey, refer to us, we'll help you with this if you refer to us. There are certain regulations that might be new for you that you'll just want to be sure your team is aware of, and you may want to update a policy or a procedure related to that. Thank you, Allie, for answering in the chat too.
Yeah, it's not the ROI. I feel like those are more dependent on agency, but there are some templates around there.
That's great, thanks.
Yeah.
There also is a link. So for those of you that are in Los Angeles or in other areas where you are not the direct, you don't hold the direct contract with the managed care plan, but you may have a work order or an MOU with, the county entity that does, you'll want to check out the oh, it didn't attach the link. The section on business associates. Let me get this link for you. And that is also on the HHS website. And that will outline what is expected of business associates, because in many of those work orders, there is language saying that, you are a business associate of this agency that is, complies with all federal HIPAA, or maybe it just says federal privacy and security standards. So read that language carefully to understand, what specifically are you expected to maintain in terms of documentation and records. For business associates, you'll want to think about what your procedure is if a client requests their records. You are obligated to comply in that sense with the ability to respond to client requests for the viewing their documentation or making changes. So you'll need to have a process in place for storing information securely, keeping information private, and then also for providing access to it if clients ask for that. The Office of the Inspector General also does give guidance on policy training and education programs. And so these are quotations from OIG on what they encourage. So they do encourage using real life examples and having training during onboarding and having it be a regular job requirement. And as I said earlier, documenting who's done the training. They also include an element that, take with it what you will, but testing employees' understanding of training topics. This is something I think really can be helpful, not actually as a test or, checklist or yes, no answers, but more in coaching and supervision. But that's something that you'll want to outline how you are doing that. So how are you ensuring that employees understand the processes and the policies that you're putting in place? So these are some of the trainings that, in the first 2 weeks, staff are onboarded and have lots of new information coming at them. Oftentimes they're shadowing other staff, so they're starting to meet clients, but maybe you don't yet, they don't have a caseload of their own. This is a time where you'll want to go over your general policies and those that really are about conduct, staff and client rights, child and adult abuse mandated reporter, actions and documentations, and your organization mission, vision, and value statements. And of course, any other HR policies that are important to know about and sign within the first 2 weeks. Those first 2 weeks, unless the staff member is working with clients, that's not the time where we can really expect them to retain everything on procedure. And if they're not encountering clients at that time, those procedures may not hold a lot of meaning, or they might not be retained very well. So we do recommend then also having a training plan for the first 90 days. So as someone is going through their first 3 months of employment, what do they need to be aware of and review with their supervisor or in a formal training related to actual process requirements or steps to take when there are health emergencies, or when someone, is having a crisis, or when safety is at risk, and what to do when, who to contact, how you connect with your supervisor, and all of those processes in handling day-to-day challenges and opportunities that staff face. Within the first 90 days, some of those trainings then we recommend you carry on annually. HIPAA compliance, the fraud, waste, and abuse, those are, and child and adult abuse, those are typically mandated to be held each year. Some of the others we recommend that you review each year as staff are there longer. I notice that if I'm training someone in their first 30 days versus day 89, they're going to have more questions on day 89 than they did on day 30, because they've seen how things work and they're also seeing how things fall through the cracks. So it can be really helpful then for these annual trainings to get feedback from staff then on what's working, what's not working, and having discussions about the process. So this can be a part of your annual policy and procedure review as you do these trainings, more than just check the box of the training being completed, hearing staff feedback on what works and what doesn't. I have one example. We had policies on staff and client safety, and for staff that were, working in the community, in the field, oftentimes working with people who, as they were exiting from homelessness and moving into housing, we had policies related to giving clients rides in cars and how to stay safe. And one of the policies included language about not permitting weapons in vehicles. And, those who wrote the policy thought that was a very safe and realistic thing to do. And as we were reviewing it with staff, thankfully someone raised their hand and raised the reality that, most of our clients do have some sort of weapon if they are living on the street and wanting to protect themselves. It's often a knife. So I don't know how I would help someone move into their home with all of their earthly belongings if I'm not supposed to, if I'm not supposed to transport them, or no one is supposed to transport them. Like, how will they literally move their things? And so we brainstormed it, we talked about it as a team, and the groups, came to the conclusion that, we would only move people in vehicles that had trunks to their car, and that you could use the trunk of the car for putting personal belongings. And that's a discussion, we had to practice and model how we talk about it with clients, to talk about everyone's safety. So it was an eye-opener for those of us that were in quality improvement, thinking like, of course you don't want weapons in vehicles, or any, it's not safe for staff, not safe for clients. But it wouldn't work. And if clients didn't feel like, or if staff didn't feel like they could truly voice it and give feedback in that moment, it would have been a missed opportunity, and it would have been a policy that just, was meaningless to everyone. So we ended up being able to revise the procedure to talk about it and have a real conversation about, how do you talk to clients about this, and where do you put belongings, and what if someone wants to hold their purse on their lap, but it has a knife in it. So what does that mean about assessing client behavior and risk and agitation? So it led to some really good adjustments to the procedure. But this is something that in these annual trainings, it's good to bring questions back to staff. Again, also just thinking about staff supervision and case conferencing, this is another time to review policies and procedures, and to hear from staff, if it aligns with your agency mission, with their vision and values, and making sure that the language in the policy is person-centered, is validating to the staff, and that you can actually talk through real life situations. So that case conferencing can be a good time to talk about policies and procedures. So some of the challenge, I think, in using templates or using, Googling for a policy or a practice, is that the language can be really formal and may not resonate with staff, may not resonate with clients. So this is an opportunity then to hear feedback. And I think it's important to to document what's talked about in supervision and to have channels and maybe a process in place where feedback is then sent to your QI team or to those who do the review of policies and procedures, so you can make sure it's meaningful and accessible to staff and clients. So I'm only going to touch quickly on quality reviews because we did talk in the compliance training a bit about internal audits. In your quality improvement plan or your policy related to quality assurance and quality improvement, you'll want to identify, are quality reviews happening? Are those reviews including chart reviews and, ensuring that HIPAA compliance is happening? Who is conducting that? Who then follows up if something is not in place that should be in place? Is it documented? And then what is the process for including others in correcting that action to prevent it from happening again in the future? I'm going to share, we also have a HIPAA checklist that I will put in the chat right now. And this is a checklist that we want to, it can help your agency to get started on, sorry, let me pull it up, help your agency to get started on, where to begin with HIPAA compliance. So it will walk you through questions about how your files are stored. Are staff trained in certain elements related to HIPAA privacy and security? Do you have a plan for those staff trainings? Are you working with supervisors to review those standards in supervision? So it can help walk you through, if this is brand new to your agency, some of the things that might be easy, check the box, yes, we've done that. But there are other things that are going to have to be regular processes for reviewing, like, reviewing client chart security. So ensuring that it's behind locked doors. We'll go into these details in a moment when we get to the HIPAA section. But there are some infrastructure examinations that you'll want to do, and then figure out how are you going to follow up. So if your agency uses fax machines and copy machines and protected client information happens to be left on one of those machines, what happens? Is there a shredder nearby? Do you have someone to check with, making sure that it doesn't go to the shredder, it goes to the right case manager instead? How often is the office checked for things like that? Maybe you have great file cabinets and you have client charts always in their own individual file, but those file cabinets are kept with the key in it. So it's not locked because the key is right there. That was a process intended to make it easily accessible for staff, but that's not going to be considered HIPAA compliant. So how are you ensuring that only the right staff have access to that key and that it's, behind a second locked door? So this is something that can help you just to start thinking about your systems, your electronic systems, the vendors you work with, who you send information to. Are your emails encrypted and do you have a disclaimer at the end of the signature? So we want to provide you with this. I'll put it in the chat right now. The second checklist I have is related to the policies and procedures. So wanting to make sure that if you just want a simple checklist of do we have these policies and procedures in place, I'm going to upload that as well. We'll make sure that both of these also get added to that folder that includes all of the templates. So here's the policies and procedures checklist. Okay, and then let me take us back to the slide deck. Okay, you will want to have written in your QI plan and in whatever policy how you enforce anything that was found to be inconsistent with your policies and procedures and how you will report that. So this again is a part of the corrective action planning and enforcement. I want to give a bit of a warning, I guess, just about how we think about quality improvement and managing risk, and that there are multiple ways that we could write a policy and a process to support staff or to add burden to staff that could produce the same result in terms of compliance. And so the goal would be that we're able to write policies and procedures that are supportive to staff and honor clients, center tenants, and the care that and services that we're providing while still managing risk. So I have an example. There is guidance around documentation that, the service plan and any progress notes written for someone need to be individualized and only for that client. When staff are seeing 8 people in a day, or even 4 people in a day, and doing many of the same things or having many of the same conversations, or maybe going to the Social Security office 3 days in a row with 3 different clients, it's not uncommon for staff to develop shortcuts in ways that they write their notes. This could be a shortcut in, abbreviations, which should be allowable as long as the reader can understand it. But it could also be shortcuts in terms of copy and pasting common language. So maybe it's an activity that is, done and provided to multiple clients one week. And so as they're writing their progress notes, they are copying and pasting this. This is known as cloning. Cloning a document or cloning a health record when we think about healthcare compliance, and different agencies' policies look at it slightly differently. So nowhere have I ever seen it encouraged. I've only seen it discouraged or prohibited. But I think the difference between this less risk-averse policy on the left and the one on the right is what it will mean for the staff member and ultimately possibly for the client. So on the right-hand side, in the past, I know of one agency where they had prohibited cloning from happening, and their policy was very direct, and the process said, if staff do this, it will be a warning, then it will be a suspension, and then termination. They did not want to in any way have a claim returned because the funder thought that they were, making up records, submitting false claims or fraudulent claims. And so there was a heavy concern about that. And as a result, they ended up terminating several staff because of this. And those staff were beloved by tenants, were excellent case managers, really struggled with documentation and time management related to documentation. But had they worked at the agency on the left, the conversations and the disciplinary actions may have looked slightly different. On the left-hand side, you'll say that they recognize that cloning might happen, but they say that, there's this clause here that providers must review their notes for accuracy and relevance prior to signing it, essentially. So if that case manager, in fact, did the same activity with both clients, one on Monday and one on Wednesday, there's nothing that prohibits them from using the same language, but they must ensure that that was specifically what happened. And so that response might have looked more like coaching around how you can, efficiently complete your notes, how you might personalize one to add an additional sentence so that you can ensure that the reviewer is not thinking this is cloned. So I wanted to provide this example just to say that as you're reading through the policy template and the sample language, think about your own agency and your staff and ensure that you're bringing them into the process to think about what does this mean for them? Because some of these templates come from much larger or bigger healthcare agencies that are thinking about compliance on a much bigger scale, and you might want to tailor it to be appropriate for your agency and only what's required for you if you're providing community supports and are a business associate under HIPAA. Okay. Any questions? I'll check out the chat just to be sure. Okay. Okay, I want to give you a chance to open up the policies and procedures templates. So open up that checklist, open up the links that Ambrosia and Allie sent, and let me know if there's anything that's missing or any questions that you have for the group on other policies and procedures. Also would love to hear if anyone in the group has already developed your policies and procedures, and if you're wanting to share with colleagues for feedback, or or if you feel good about them and are up for sharing if someone has one that they're looking for. And we're happy to take a look at it and pass it back out or remove identifying information if you don't want your agency name on there. But would love to keep the learning going. Tanisha, I see your hand. Go ahead.
I just have a question about the last slide when you were talking about cloning. That also, am I correct in that also applying to not just case noting, but any other kinds of documentation that you are collecting for providing services?
Yes.
Or for requesting authorizations or anything like that?
Yes. So that would be true also for like individualized services plans. So I've seen, some service plans, you may have check boxes of these are specific needs, because it might be things that are common to, many people experiencing homelessness may face certain of the same barriers related to employment or not having regular income or something like that. You can absolutely have check boxes. It's really common in healthcare to have, drop down fields. So that you just want to ensure that there is a place to put a personal note. That's where, individualized service plans and assessments, it's great to use the client voice, any quotations, to add something about the client's individual strengths so that you are tailoring it just to ensure that anyone reviewing is not, not thinking that you're cloning.
Thank you.
Yeah. I hope that answered it. If not, feel free to go off mute again.
That did. Thank you.
Any policies or procedures that you're feeling tripped up on right now that you'd want us to work through together? Okay. Ellie, any lessons learned as you're tailoring for organizations that you'd want to share?
I mean, I think that for some of you, this all might be like, yep, we have a lot of these already in place. We've been around for a long time. Like, this is not a big deal. And for others of you, you might be thinking, oh my goodness, this is a lot we need to do. We don't have any of this in place. And where are we even going to start? And I would say that it's all valid. And just the point is to kind of look at what you do have in place, figure out what are the most crucial things that you need to get in place before you start your Medicaid services, and go from there. And it doesn't have to be all perfect. And in fact, you will likely be revising as you move forward. And that's okay. You just need to start somewhere. So if you're feeling super overwhelmed, that's not uncommon. And just, find a place to start and go from there.
Thanks, Allie.
Like official legal advice, but to give you an idea of what things you should be looking into, things you should be thinking about, and kind of a general overview. There's trainings on HIPAA that are literally days long. So we're not going to get into that level of detail, obviously, but hopefully we'll get you pointed in the right direction. All right, so HIPAA includes both rules around privacy, what you can disclose to clients and to other parties, and also security, so what you need to do to make sure that information is kept safe. Privacy standards apply to all protected health information, which includes things like diagnoses, medications, treatment plans, providers, services received, anything like that that is related to the person's health. And it includes things that are shared in conversation, in writing, or electronically transmitted, or overheard is another thing that could happen. So privacy standards are about who has the right to share and who has the right to share what information and when they have the right to do so. And so as Kelly had said in the chat, like there's different standards around mental health information. There's different standards around substance abuse, child protection, that type of thing. So in terms of who you can share that with and when, and that's why it's important to get the training so you understand and your staff understands when these different things apply. You can go to next. Clients also in addition to talking about your responsibilities as a provider, the HIPAA privacy rule also protects clients' rights. So clients have the right to ask and see copies of their health records, have corrections added to their records, receive a notice explaining how their information is used and shared. And I think I put the notice in actually earlier in the chat. There's a link to on the HHS website, the Federal Health and Human Services, a model for a notice of privacy in information or privacy protection. You know, like if you've been to a doctor, usually you have to look that over and sign it. So you should be doing something similar in your agency. Clients have the right to decide if they want to give their permission before their health information can be shared. And they need to know if their health information privacy was breached. They also have a right to file a complaint with the provider, insurer, or the US government. And so going back to kind of tying it into the policies and procedures discussion we just had, you're gonna wanna think of each of these kind of instances and think about how you will respond if any of these things come up. I think Cheryl kind of talked already about like, what are you going to do if somebody asks for the health information? Who pulls it? Who double checks that it's appropriate to pull it? What is your process going to be if there was some sort of leak of health information privacy in terms of notifying folks, that type of thing. If you think of it ahead of time, it's going to be a lot easier in the long run than trying to respond in an emergency situation. Next slide. So in terms of security, how to keep that information safe, you're going to be wanting to ensure that all your client records are secure. They are legal documents, and they can include the electronic documents like what's in your electronic health record or your medical record, but it also includes paper or scan records. And under HIPAA, you have, they call it reasonable steps must be taken to keep the records secure, which we'll go through on the next slide. So some of the reasonable steps that you're going to be wanting to look at are automatic logouts of electronic records and computers, passwords on everything, passwords within a software program if you have like some information that's stored in certain areas of the software that is accessible to everybody in the agency, and then others that is only accessible to you. You might have different like checkpoints within your program to add your password in, and that is something we'll talk a little bit about checking with your any of your client storage software or client record, you know what I'm saying, client record storage software to make sure it's HIPAA compliant, and that would be part of what you might want to ask or talk about. Unique usernames and passwords, and then screen covers for phones, tablets, and laptops.
And I'll add here that I've had conversations with some of the largest HMIS vendors in California who have, some of them have shared that their software is HIPAA compliant, but what they can't control is how agencies are using that. And so, you know, the automatic lockouts of a computer that, you know, if it's not being used for X number of seconds or minutes, that it returns to the password login page, that passwords are changed regularly, that there's a requirement around that. What the staff at these agencies have said is they do have these things in place, but they can't claim that it's HIPAA compliant unless they can ensure that you are providing HIPAA trainings and, you know, doing all of these reasonable steps. So that's something, you know, when you're asking a vendor, is it HIPAA compliant? You might want to say, is there, you know, is the data encrypted? Do you have mechanisms that if we are doing everything on our end to keep it HIPAA compliant, is everything on the data system storage side also in compliance?
Private client information should never be kept in an unlocked drawer. We talked about that already too, or in a vehicle, or anywhere other than a unique file labeled for the client and secured and locked. Use client initials when discussing or writing about client in unprotected settings. Avoid using identifiers and non-secure records like email. Also think about if you have the option to encrypt emails that you're sending outside of your agency. If you're going to be sending any protected health information via email, there are different, you know, programs that you can get to get the encryption done, and include a disclosure statement at the bottom of your staff email signatures.
Let us know if you want to see some sample disclosure statements, or if anyone wants to share one that your agency is already using. You probably have seen these for agencies that are, you know, providers already of mental health or behavioral health or substance use treatment providers. They often have a disclaimer at the bottom. I do want to say one thing about this, you know, client information should never be kept in. This is again, when we think about what's the policy versus what's common. So it's not uncommon for staff to pick someone up from a hospital or from a medical office, and they may have paperwork with them. The client might have that paperwork. This is where if the client is holding that paperwork, that the client's in ownership of that paperwork. If they're wanting you to help store it and you're transporting the client and they're there, you may want to put in your procedure that that is, you know, that is considered safe while the client is in the car, and that as soon as it goes into the office, that it is put within a drawer, not left on a desk or something like this. So there are ways that you can say, you know, documents will be in vehicles that have client information. But when you park that vehicle, where are you storing it that you're putting it in the glove compartment? And, you know, and if you're walking the client up to their door because they need assistance or something before you're going back to the office, there are going to be cases where you'll want to be very clear that nothing is left visible in a vehicle, that it needs to be stored in the client file as soon as possible.
Yeah, and then Bridget said you can also get a lock bag. I've seen folks with those.
Yes.
Too. In terms of viewing electronic information, screen protectors, password protection, and then Cheryl already talked about the fax machines and copiers, so we're good on that. So here is a suggested to-do list. We already mentioned reviewing the data systems with your vendors for HIPAA compliance. The other thing to think about is I worked with a number of agencies that don't have electronic health records, but they have like case management software that they use to keep track of case notes and client information. And so don't forget about that part of it either. Perform a risk analysis of current policies and apparatus. there's the HIPAA training. So I don't know if they have a specific one in California that they want you to do, Cheryl. I know a number of the MCPs have them available and offer them for free. Maybe even all of them, I'm not sure, but I've definitely seen a number of them. You can also design your own. That would be rather ambitious, but there's also ones you can like purchase online, or sometimes like associations of housing or health associations have them available too.
Yeah, I would also say I can share it via email after this, but it's linked in the template around documents that you'll want to review. The expectations of managed care plans in helping community supports providers have safe and secure data systems and have ways that you can share information back to the managed care plans. That is something that they are advised and expected to be assisting you with. So if there are trainings that you don't yet have, or if some of this compliance is a challenge for you, I think raising that to them and pointing out the sections where the Department of Healthcare Services is advising that managed care plans assist community-based organizations in being able to share this data and this really important information back with the plans is going to be helpful for you. As there are so many staff at the plans working on this, not all of them might have read each piece of guidance. So sometimes we need to point out specifics.
For sure. I think also related to this part of the conversation is that, you know, we've had agencies that I've worked with here in Minnesota where they've contracted a lawyer to review their policies and procedures, which is a good option potentially depending on like where you're at and what kind of resources you have. I just would say approach with some skepticism, because if you start Googling like HIPAA compliant stuff, you will get a lot of people trying to sell you things. And I mean, we're not in the position to kind of recommend one thing or another. I'm sure some of them are great and super helpful, but I would, get referrals from other agencies, and just kind of do some background research before you end up shelling out a lot of money for something like that.
Mm-hmm. And thinking about the amount of risk as a community supports provider of how much protected health information you'll really be storing at your agency versus a massive hospital that has 9 offices, and they have whole teams of lawyers that are only working on their HIPAA policies and procedures. So a lot of this targeted marketing and wanting to sell you things related to HIPAA is often for these massive institutions, and not necessarily going to be the most helpful.
Yeah. So we have the compliance checklist that was attached in the chat earlier. I'm also going to add a document in that we did for providers in Minnesota. There's a couple links in here that are like specific to Minnesota that you can ignore, but most of the information is applicable to anyone covered under HIPAA and would be useful. So feel free it's like an FAQ, so you can feel free to look at that too. Oh, I was going to ask you, Cheryl, the other thing is, in California, do you have like state protected health information rules that people have to follow in addition to the federal ones? You might just want to talk about
there
that.
are, however, the community supports, again, because it's not a benefit under Medi-Cal, then many of those privacy requirements and the security requirements apply to specific types of providers that wouldn't be community supports providers.
Okay. But it might be something to kind of keep an eye on.
Yeah, and if you are a mental health or substance use treatment provider, then there are additional security. Yes, they're related to sharing data and how it's shared, when it's shared, that are more restrictive than HIPAA. Right. That you'll want to be mindful of. Yes.
The other thing I would mention is in the document I just shared, it talks about hybrid entities. So like if you have different business lines that may or may not be covered under HIPAA, you might have different rules in your agency depending on like what people are working on. So that is also something to keep in mind, like for maybe some of the stricter privacy and security stuff that you're applying it only to the folks that are actually working with the protected health information, and you don't necessarily need to do it agency-wide. However, I kind of feel like in this line of work, right, where you're dealing with sensitive information, whether it's protected health information or not, and it is kind of respectful, I think, to clients to be aware of what information you're sharing with others, protecting their information, protecting their identifying information. So it might be a good opportunity to overall look at your agency and just make sure that you're doing all you can to protect people's information.
Sally?
So.
I want to highlight the TA marketplace. I learned a few additional pieces related to data security this last week that I want to highlight. If you are applying for technical assistance or if you're applying for a cited grant. And for those of you that have received cited grants already, if you want to share in the chat with the group about your experience, I'm going to share quickly about this, technical assistance and then cited, and then we will end the recording so that we can have open discussion. What I have heard that, cited, these are grants that come from the Department of Healthcare Services. You can apply for them. The second round is closing at the end of May. So in about a month. You can apply for infrastructure related grants that are specific to data systems or software, or if you know that there's something related to encryption or compliance, or you're looking at purchasing, a new case management or electronic health record system, you can apply for grant funding related to that. However, you will need to specify the percent of your program or agency or number of clients that you'll be serving with this system. And so these grants can serve or can cover only those that are going to be served by enhanced care management and community support. So if you're working with people and you know that 90 to 95% of the people that you're serving are likely eligible for enhanced care management and community supports, it's a matter of them getting enrolled and authorized, then I would say this is a grant opportunity for you to grow how you are tracking your data, or, if you need legal advice or a consultant to help you build out your policies and procedures, this is a great opportunity for that and something that was structured specifically for it. If you have 5 different lines of business and only a very small portion will be community supports, then this type of grant structure for covering a data system, if you plan to use that data system for your entire agency, but only 5% of those people are going to be receiving enhanced care management or community supports, that grant will only be able to cover the percent of that purchase that is for these programs. So this is just as you're thinking about, not wanting to have 5 different data systems or updating things for your entire agency, and who is eligible or who that you serve meets the criteria for community supports, that's going to be a consideration as you apply for these grants. So that was something new that I had learned. I just want to pass that along. And then for the TA marketplace, I've also just heard that they are getting many requests for TA for off-the-shelf products, but not so many yet for individualized technical assistance. So if you are going through your checklists of policies and procedures and you've got a lot of work to do, you may want to be applying for individualized technical assistance. And there are providers who are consultants who are capable and waiting for this type of waiting to support you that are already registered with the state. So it would be paid for by the state. The sooner you get on it, the sooner you'll receive that assistance, because there is a process where the state matches you to someone that's able to do that type of support. And then, you know, that you have to develop a work plan with that TA provider if you want them to write up policies for you. So again, the applications have opened. I know that they have had over 40 agencies apply, but they have room for many, many more. So I'd encourage you, as you're going through your checklists and readiness, think about applying for that individualized TA. Okay. So we're at our next steps and reach. I want to ask you, please take a chance and read, if you have not yet read the Community Supports Policy Guide. That is what is created by the Department of Healthcare Services, talking about how community supports are provided. That's going to be really important as you're thinking about your processes and the policies you need in place. And then go through that HIPAA checklist and the policies and procedures checklist. Read through them and let me know if there's anything else you want added to it. We can update those folders, and I want to make sure we're getting you the templates you need. And again, I put the link for the TA vendor marketplace and just want to encourage you to think beyond the off-the-shelf products. If there's any specific individual technical assistance you're looking for, reach out. And then we have our Medi-Cal documentation standards and processes next week. This is going to be helpful if you have middle managers that are overseeing staff, supervising staff providing direct services, staff that are writing service plans and progress notes, and any information or assessments to reauthorize someone for ongoing community supports after it's been 6 months or a year of them receiving services. These are the staff you'll want to attend. We're going to get into the best practices and requirements that go into documentation.